and another adjustment right here. So tell us how you feel just sitting up.
Oh my gosh, brighter colors all around. The brain fog just immediately leaves. It's insane. And just completely clear neck.
Are you sure we didn't slip like a drug in there, like a medication?
No.
We didn't have to go through a cabinet and say, which one of these medications should we give you to work on your brain fog? Yeah, we actually fixed the cause of it.
Oh my gosh, that felt amazing.
It's all blocked up here. We open it up, blood flow, cerebral spinal fluid, everything immediately perfuses the brain, and the person experiences a brighter world. Really, we have a lot of patients that explain it like that.
Yeah, that was awesome.
Goodbye, brain fog. And does your face hurt?
No. It's all gone.
Isn't that wild?
It leaves immediately.
And then we're going to progressively keep getting that, so it'll stay, and it's never going to come back. We're going to eventually get there, okay?
All right.
All right, here we are with Erin Sanabria. Tell us this is her first visit in here. She came in with some crazy symptoms she's been searching for, going to different doctors. Tell us what you had and what doctors you've been to.
So I have trigeminal neuralgia. Also, I just a lot of brain fog and a dull headache all day, every day.
What is trigeminal neuralgia for all the people listening?
It's a facial nerve pain that is doctors don't seem to know the cause of.
Well, yeah, you've been to different doctors that look at it. And there's a lot of people suffering. If you have trigeminal neuralgia, you know someone that does, go look at our other videos. We have a lot of cases that get completely better. Some people don't have any neck pain or anything, but it can be a problem related to the top of the neck, all right? So here we are going after this. So this is our first visit. What do you feel right after we did our correction to the top bone in our neck?
My neck I don't remember it being this loose ever.
And did you still have pain in your face?
I do not. It's
really?
all gone.
Wow, it is as good as you said.
Right now, at least. I hope it stays away. Chewing gum.
And that usually does what?
Usually there's nerve just going crazy in my face. Little electric shocks.
So sorry you've had to deal with that. That's terrible. But it's on its way out the door, isn't it?
It is.
But her neck, it's going to tighten right back up, and we're going to stay on top of this thing, all right? So she's going to be completely symptom-free. We're going to get her completely better. And let's go look at the x-rays real quick. I'm going to leave her there. Let me show you. She gave us permission to show this, but look at this. You guys ready? So here's her neck. She has a reversed cervical curve, which is its own problem, right? But look at this. This is her neck. This bump right here are the bumps that you can feel in the back of your neck as it goes up. Should be right in the middle. Hers goes up just fine until you get to the third bone, and then the second bone, it's way off the center point. The center point is measuring the front of that second bone, and this is the back of it. So it's completely rotated, and you can see her head's very straight there in the image. We also have another view here. This is the atlas bone, it's a ring. The atlas is the top bone of the neck, and her skull. This is rotated 2 degrees off, which is about the average we see in our clinic. Here's the spine right here. This bone, we just saw the back of it, was featured way off to the right compared to the other bumps. And we compare that to the front of the bone. And this bone too was rotated. So that's pinching off cerebral spinal fluid, nerve conduction function, blood flow. No wonder she has foggy headedness. Her brain is demanding oxygen and blood flow and cerebral spinal fluid, and it can't get up there because there's a physical blockage up here, okay? So that's what we're looking at, and that's why we see someone like her getting a ton better, and she deserves it.
I've just had a lot of facial pain going on, been to several doctors that no one has seemed to know what's going on, misdiagnosed, and today feeling a lot better.
And tell us about what your head felt like.
After?
Yeah.
Amazing. Clear, no brain fog, no migraine that's just dull up here always, and no face pain.
Just one little visit, we realigned the top bones of her neck, and we're able to help her a lot. And what do the doctors usually tell you?
The first doctor ignored me completely and didn't even want to listen to that I was having face pain, and they just want to put you on medication and keep you drugged up with pain meds. Hey,
Erin, what's going on? So from last visit, the first day, you had a huge change with your trigeminal neuralgia. Can you describe how that's been since with the head fog, the trigeminal neuralgia, and what other things you've noticed?
I've noticed that the pain did temporarily go away. It is back, so I'm going to keep working on that. The brain fog has definitely cleared up. I slept better than I have slept in years, with just feeling like I was dreaming, which I don't normally feel like I'm doing.
A lot of people call me the sleep doctor. We have actually a lot of different ways of doing that. We'll do upper cervical work, which realigns the top bone, so it allows the cerebral spinal fluid to move, and once that moves, the fluid going through your brain, the whole point of it is this is always moving right now continuously. This this is another example right through that spinal canal. Fluid is always moving through us right now. At night, it speeds up 40% faster. It clears out brain plaque. That fluid is clearing out your metabolic waste. Your neurons release waste. That fluid cleans it out. No wonder people sleep or they have dreams. Go look through our other videos. A lot of patients are like, man, I had actually dreams where I didn't feel like I was being terrorized, or I finally dreamt for the first time in a decade, you know? And so that's one thing. The other thing we use is lasers on the brain, which we haven't done for her, but that will improve blood flow and oxygen flow and stimulate new neurons to form. And people almost always will have better dreams, or they have really vivid dreams. So there's a lot of different tools we can use, even nutritionally, going after the brain, and we can get people's brains to function better. And one of those results is sleeping deeper. Is that what you said?
I did. Definitely slept deeper. I woke up feeling refreshed, which is not normal for me. And like I said, I felt like I was dreaming.
After we did the treatment today with realigning your atlas, tell me what you've noticed. Anything?
So after resting for a few minutes, I'm feeling wetness in my ear canal. I've never felt that before after treatment. So I asked him if it was normal or abnormal.
And are you sure it's wetness, or it feels like it could be wetness?
I don't know. I can't, when I stick my finger in, I can't feel any wetness.
People have a lot of the tinnitus or fluttering or fullness in their ear, feel complete release.
Maybe that.
But the ear canal may change in the tension that's in there. And it's in the medical literature, they call it like middle ear ventilation. It's changes, so that's probably what it is.
Yeah, neat.
Yeah.
So on the left side of my face, I was having electrical shocks all day long, going through my cheek. That would start at my ear, down across my cheek to about mid-mouth. That would happen anytime I moved my mouth, touched my face, brushed my teeth, ate, anything that had to do with my mouth or moving my mouth.
Wow, that's crazy to think about. Imagine that all day, every day, or did you get some breaks from it?
No breaks.
No breaks? Did you sleep?
The more you waited in between moving your mouth, the more painful it was in between, because it would just stiffen.
Wow, and so this was pretty constant. How often was it hurting, like intensely?
It would get up to like 8s probably when I would be having those shocks, but then it was just like a dulling pain all day long, probably like a 2 or 3.
All right, and so the trigeminal nerve is the nerve we're talking about. There's a nerve in the face called trigeminal nerve. It's the sensory to the face. We have a motor nerve that's called the facial nerve, and that's controls the motor control. But the sensory pathway is what she was suffering with. And in the trigeminal nerve, there's 3 branches. There's V1, V2, and V3. It looks like both of those were the ones that were coming up on her. So you felt it in your jaw, on your teeth there. What did you think it was initially when you started getting this, and how long ago was that?
I went to the dentist like a bunch of times asking if I had any problems with my mouth or teeth or cavities, and they looked at me like I was crazy. They're like, no, you do not. They're like, we cannot find anything. And so then I went to my medical doctor. I got misdiagnosed a few times. They put me on a medication that made me a walking zombie, and I could not live like that.
Oh, terrible. But in looking for that, you figured out the solution. So how long did it take for you to start noticing the improvement after we did our upper cervical alignment? Now remember, there are a lot of chiropractors in this world. We all have different specialties. We do a technique in the upper cervical world. So in the upper cervical world, there's going to be different practitioners that have different ways of moving these top bones of the neck. And if you are suffering with this or know someone suffering with this, you'll have to find a specialist who can objectively look for evidence of a problem being there. If there's no reason to work in this area, we're not going to work there. We can send a person to their medical doctor, because some people with this issue, they have a strangulation of the actual nerve. In her case, she actually had the cervical nerves here were tight and strangling the sensory feeding into this nucleus here in the brainstem called the trigeminal cervical nucleus. So get that. That's the trigeminal nerve, and the cervical nerves go into the same nucleus. So irritation here, the pinching and irritation here was causing the facial pain. Did you have any sort of pain in your neck?
No.
So wasn't that a crazy notion when you're like, I think it's coming from your neck?
Yes.
Think about it like this. A lot of people have sciatic pain, which is pain down the leg. Some people with sciatic pain only have it in their big toe or in their foot. But the pinching comes from the back or the piriformis muscle. So the pinch occurs here, but the symptom shows up there. Same kind of thing with this. And there's a lot of cases that happen like this. So Can you tell us also how quickly it took before you started noticing that this helped?
It was pretty quick right away. Within a few treatments, I started getting a little bit relief, a little bit, and every time I came in, it was longer and longer in between those electric shocks to where it's virtually gone now.
Yeah, every several weeks or months you come in just to get checked, and it's there. Does it exist at all since you came in today?
Just little, hints of it, but nothing like before. Nothing. It was unlivable before.
Well, thanks for sharing that. I really appreciate you getting the word out, because a lot of people don't know about this, and obviously dentists and doctors don't always know the exact origin of the problem.
Yep.
So thanks for sharing that with people.